Hi, this is Dave here from ProSport Physiotherapy in Huddersfield, and today we're just going to look at some common ankle symptoms that patients usually come in, both sporting and non-sporting patients. And the ankle and foot is quite complex in that there's so many bones. There's 26 bones in the foot, and there's a lot of little ligaments between these bones, and each of these ligaments and each of these bones have specific functions and they need to work well as a unit. And I suppose the common thing that you might see, and a lot of people actually won't go to physio with, is just your standard kind of rolled ankle, where the ankle comes in, rolls under the body and almost kind of gives way. And usually you'll kind of disrupt some fibers of your ATFL there. Now, a lot of people will do that, and a lot of people actually won't have an ATFL anymore, and that's absolutely fine. It's, as I said, most people get on with it. Their bodies adapt. Their bodies are very durable, and they have no problems on the back of that. And usually what happens with that is the ankle joint itself might just swell up a little bit for a few days. You might ice it, you might put some compression on, it'll feel a little bit sore, you'll feel like you're limping a little bit, and then after a day or two it usually tends to settle, and within a few weeks you're back to normal. Okay, so that's your traditional kind of ankle sprain. Now there's one big injury that usually goes amiss, okay, and we're very fortunate working in rugby league that fortunate from a physio point of view, we get exposed to these injuries quite a bit, so we don't tend to usually miss these, and that's what's called the ankle syndesmosis injury. And what that is there's a ligament between your tibia bone and your fibula here, and there's a little ligament that just kind of keeps those together, okay, and that's usually referred to as your syndesmosis. And those ligaments there's a front and a back ligament, they're vital in order to keep the stability through the shin, okay, and keep that nice congruence with the ankle joint. So if that ligament disrupts, usually you just get a little bit of gapping of those two bones. Now that's important because that ligament doesn't usually tend to swell a lot, okay. Now that kind of presentation, you think, okay, I've twisted my ankle and you know it's okay, there's not a lot of swelling, but actually I just feel a little bit flat-footed. And the mechanism for that injury is usually the foot gets caught in the floor and almost the knee kind of comes inwards, or it just gets twisted, okay, so you kind of have that rotational force, almost similar to an ACL injury, okay, where that knee kind of drops in and twists as the foot gets caught in the floor, okay. Now your symptoms for that is, as I said, there's not going to be a lot of swelling, but one thing you will struggle to do usually, and that's go up on your toes very well, okay. It'll just feel heavy, it'll feel like you want to do it, but your brain just won't let you do it. And that's usually just telling us that the nervous system doesn't feel safe, or doesn't have the stability in order to recruit the muscles, okay, around that ankle, so that kind of stability mechanism is compromised, so the nervous system almost shuts down the electricity to the muscles, so to speak, okay. So that's an important one, that if you've twisted your ankle or your foot got caught on the floor, if you twist and you still have ankle pain, your foot feels a little bit floppy, especially, you know, athletes struggle when they get up to top end speed and they need that stiffness in the ankle, you know, when they're sprinting. That's usually where they get found out with these injuries, and then they tend to drag on for quite a while, to be honest with you. They can take up to, you know, 12 to 16 weeks if they're not identified very, very quickly and treated appropriately. So with that syndesmosis, usually we would like to see that patient in a boot as soon as possible, just to take as much weight off the two bones to stop any further kind of gapping like that, okay. But as I said, unless your foot got twisted or got caught on the floor and you twisted, or you fell on it and you got that kind of rotational twist as opposed to that usual kind of inversion injury, then don't worry about that. But if you have that kind of twisting motion, then that's something that we would need to consider, okay. Usually if you've had kind of ongoing ankle problems and you had that mechanism, then usually the ankle joint can get a little bit grumbly, and there's a lot of adaptations, as I said, that usually we can help with in terms of rehabilitation exercises, but also some hands-on treatment to help that. Then we also can have just some kind of wear and tear around the ankle joint, okay, where the actual joint surface itself, okay, just sometimes it can grow a little bit more bone on it, so you can get a little bone spur in that ankle joint, and then usually that will kind of result in a pinch in the front of the ankle, okay, or that ankle can get a little bit sore when you're squatting down or something like that, or sometimes even when you're coming back up from a squat, you can just get that little pinch. Now, a lot of people will have these bone spurs, and as I said, a lot of people will have wear and tear. It's a natural process of going through life, and usually it's something causes that irritation. Okay, so the axis rotation of how that ankle joint moves can get irritated. So you might have, you know, gone for a big walk on the beach, or you might have increased your training load or something, and the tissues around the back of the ankle may just get a little bit more high toned, and then as your shin starts to move over, those tissues just can't lengthen quite as well as they used to, so then that can just put a little bit more pressure on the front of the ankle. And again, these are all things that we can change very, very quickly. Just because there's wear and tear on scans and stuff like that doesn't necessarily mean that it's the end of the world for you, okay? There's a lot of people living pain-free with bone spurs, with wear and tear along their ankle joints. So there's a lot of stuff we can do if we give the brain the right stimulus that it requires at that time. So that would be the next thing, where people just get that ankle impingement as the knee comes over the foot. Then we can also get a bit of pinching in the back of the ankle here, okay? And usually, again, similar thing where the brain kind of lays down more tissue or more bone, and then you just get that little pinch again at the back, especially when you're going up on your toes. Now again, we can understand the anatomy as physios, okay, or a healthcare professional, and understand the tone of the tissues on either side of the joint, and we can influence that with both our hands-on treatment and our rehabilitation exercises that we give you, okay? And as I said, we treated, you know, hundreds of these between professional athletes and non-professional athletes, and also non-sporting athletes as well. So they will be the big kind of injuries, okay? As I said, after you know, a general ankle sprain, ideally what you're looking for is that your ankle mobility, okay, your knee to wall test is around the same as it is on the other side, okay? And we're going to put up a little video of that test as well, okay, on a separate section. Then you also want to be able to push up and do a calf raise pretty much pain-free, okay? And you want to be able to feel the same power left and right, okay? And there are, you know, some generic markers there that we can go, okay, well, you know, the left ankle is performing very, very similar to the right ankle, okay? Now, if they're fine and you're still experiencing pain, then sometimes you just may need a little bit of hands-on treatment, or you might need some very specific loading of particular motor units of particular kind of muscles to improve that axis rotation around that ankle joint, okay? So that's your generic kind of ankle pain symptoms. If you have any questions, feel free to contact us. As I said, you know, we get a lot of emails in asking a lot of questions, and feel free to contact us if I didn't describe your particular ankle pain that you have in this video.